and we just have to address it, okay? And I was trying to mention earlier when I said protocol and anti-cancer protocol. Remember I mentioned that, right? Now, cancer is one thing that we must defeat. And by the mercies of God, we will defeat cancer. Honestly. Our first cancer testimonial, we didn't write the person wrote to us. You know, I shared it earlier. And you find out that cancer, people respond very differently. Some people have chemotherapy, some people do radiation, you know, all kinds of therapy. But sometimes, even after chemo and it clears, it comes back again. So, there is no known cause, but there are risk factors. And there are sometimes, some people, for example, we've seen people who don't smoke come up with lung cancer. Right? And we don't know what are the causes. But I tell you, like the lady I mentioned that had her session yesterday, 44 with breast cancer. And by the time we are reviewing her diet, she's also a baker. So what she does is, even after she got a diagnosis in April, she didn't cut off sugar. And she said she doesn't like vegetable. And I asked her her best food. It was pounded yam. You know, my team, they're outside. Yesterday I was furious. Like, for the first time since my practice, I felt like if I should flog somebody. And she also likes French fries, like potato chips. And I told her, you have two daughters, 9 and 7. If you don't want to live for yourself, won't you live for these people? So, when it comes to cancer, a lot of dynamics come to play. Some people have the genes that make it a risk factor for developing cancer, coming from certain, families. But now, so when we're talking to genetics, genetic mutation, and a whole lot of that, that's a very broad field. However, you will not sit down and say, because I come from this kind of family. I met a lady, she told me her mother died of diabetes. Her auntie died of diabetes. I think one of her sisters died of diabetes. So she knows that she will die of diabetes. Yes. I met her, this drink they call smoking too. They served it on the table. So, and she's unmarried though. So she has prepared her mind. She did not sit down. And instead of fighting, so with cancer, it is a fight. You will fight. And the cancer industry, is one of the greatest conspiracy theories in the... There are a lot. So one thing when I meet with cancer patients, when they go to the hospital, like this lady, she said when they went to the hospital, they just told her first point of treatment is chemo, the second one is hormone therapy because it was breast cancer, and then the third one is a mastectomy. And the doctor was not even trying to answer her question. He didn't even tell her anything about what to eat. I said, he's not trying to tell you what to eat and what to eat. Some people assume that because somebody is a doctor, sugars from your diet. This one is not saying, I will reduce it. Cut it off, because cancer cells feed on what? Sugar. Even when people go for biopsies, one of the liquids they use to test if that tissue that they have extracted is cancerous or not, one of it have sugar inside. And that tissue, the cells will respond in a way, they'll say, there's cancer here. That's what they use to activate it. So you cut off sugar. Remember that the only sugar you are permitted to use is the one that comes from natural foods.